Hi, everybody. Welcome to my webinar on resolving diabetes. I'm Dr. Sarah Scharf, and I'm just really happy that you guys managed to get online and watch this webinar. And no matter if you're an upcoming patient of ours getting ready to have your first visit with me, I typically have anyone that I'm going to be meeting with watch this webinar, or if you simply found us online, I'm happy that you're here. So we're going to be going over probably about the next 50 minutes information very specifically on what we're doing in my functional medicine clinic to resolve diabetes for individuals that have type 2 diabetes as well as those that are pre-diabetic. So what I'd like to do to kind of first start out and you know, in general, I know you guys fast forward about an hour from now, you're going to be really happy that you were able to set aside the time, because I know, sometimes an hour in the life cannot be an easy task to set aside, but I know you're going to be really happy that you did that. This information that you're going to be getting is, in a word, it'll be a bit of an awakening and understanding, gaining an understanding on really for the first time what diabetes has to do with, why as a diabetic, if you're under a drug prescribed medicated process, why you're getting sicker over time and why you don't have the opportunity to heal if you're simply just taking one drug after the next. So you'll really have a firm understanding on this, and my expectation is more so than any doctor has given you before, you'll really understand what's happening and what the root cause is, but most importantly, what to do. And because I think we all realize deep down that information can be amazing and life-changing, but only if you put it into action. So I'm going to give you details on what specifically needs to happen to resolve your diabetes, or if you're pre-diabetic, never to become a diabetic in the first place. So stay tuned. Let's go ahead. I want to sort of walk you through an important concept here, and that is okay, so I'd like to share with you really specifically who I am and what my clinic is doing and what our focus is. And first of all, I want to be really clear that I am not here to offer you a solution by adding yet another medication to layer that on. I am a functional medicine practitioner, and what that means is that I practice understanding function of the body, and I practice understanding dysfunction, and it's all based in science, very thorough laboratory assessment on where your body is in the overall frame of reference of wellness. And so a functional medicine practitioner looks way beyond the symptoms to the root cause of how you lost your health in the first place. And what we're finding with diabetics is it is a unique situation on why each diabetic is or has become a diabetic. And unfortunately, what's happening is that the diabetic community is being treated in this sort of one-size-fits-all model. Most folks are put on some sort of oral drug right out of the gate, which would be a metformin typically, and over time you're simply told to be a good diabetic, to diet and exercise, work out, put the fork down, and essentially you're going to have this disease for the rest of your life, but you need to go to the diabetic class, watch your weight, exercise, and stay on these meds. So that is just not what's happening in our clinic with our diabetics, where we are addressing why they became a diabetic in the first place and putting together very specific programs so that they can heal and turn around and without a doubt resolve their diabetes. So we are not offering medication here. So, and for the right person listening, that's good news. And nor is this a quick, get quick solution with our kind of shiny new approach to turning around diabetes. That is not what's going on here. It's a process to get well, and it's a very well supported process on our end. And as I go through this webinar, I'm going to kind of help you understand what that sort of timing takes. But people that are really good fits for our practice are those that kind of are willing to, put their hand up and say, yeah, I am willing to take responsibility for my health. And I realize that my health does not come from another new pill. And just show me the route, show me the way. I may need some support here and there, but guide me, teach me, educate me. I am ready to take this on and be responsible. And for those types of individuals, we are a really great fit, and rarely do we see a diabetic fail in our practice because we attract patients that are really ready to take things on head first. So before I jump into the details of diabetes, I think it's really important to just speak a little bit about the elephant in the room. And the elephant that I'm referring to is America's health in general. And so I ask you, where are we at with the health, America's health? Do we have a health crisis? Do we have a health care crisis? What's happening? What do you think? And I'd have to say, typically, and I typically do these seminars live throughout the Bay Area. I've got live people I'm looking at, and people are kind of at this point throughout a lot of different thoughts on why we're in the predicament that we're in. And what comes up are the pharmaceutical industry influencing the doctors. It comes up are GMOs, chemical influence on the food that we eat, fast food in general, the quality of our relationship with our MD, the amount of time we get to have with them, the training of our MD, and just kind of those are kind of like the primary themes of our healthcare crisis. And insurance comes up too. Insurance doesn't really pay for turning your health around. It just pays for keeping you in the system, so to speak. And then what I always like to interject is that I am a huge proponent of Western medicine, particularly where it's most helpful, which in my opinion is in an acute care crisis. If you've got a disease, if you're diagnosed with a disease process, or if you get in a really nasty car accident, do not come to my office. Go straight to the emergency room. Those doctors are very well suited to help you. But if you want to heal and turn something around and restore your health, I don't recommend that same group of people. I simply don't. We're not really seeing that happen in our healthcare. And so what's happening in our healthcare, what is the biggest issue, is that, and this may seem kind of hardcore, but the truth is that you're being lied to. And I know, and it's really frustrating for me to see this with my diabetic patients that I hear from in the very beginning of our process of working together. I know that you're being told that diabetes is something you just got to live with, that it might be something you inherited, that it's a lifelong chronic degenerative disease that you just kind of got to stay on top of and stay on top of your meds. But I got to tell you from kind of the bottom of my heart, and even knowing that some of my very best friends are primary MDs, they're good people, but what we do in general is that we do what we're taught, and they're not taught to turn health around. They're taught to tell you that you're in this forever and that you got to take one drug after the other. And that's just not true. And the incentive, the whole process of that sort of financial incentive comes from the pharmaceutical industry. And they're making a lot of money on your reliance on your medication. And as a side note, you understand too that all the diabetics in our practice, they're required to stay on their medication. This is not me telling you to go off your medication. All of our patients are required to stay on their medication as we, in parallel, work really hard on restoring their health and restoring their body's ability to manage their own blood sugars on their own without medication. And so over time, your primary MD does wean you off your drugs and your medications as your body's health is restored. We do that through initial testing and follow-up testing that we share with your doctors, and that's how they basically take you off your medication over time. But you're being lied to by a system that is financially gaining by keeping you under a medicated protocol. So the next thing that I want you guys to have a look at here is this next slide, and it's quite telling. So it's the World Health Organization says 90% of all diseases prevalent today are not treatable with orthodox medical procedures. 90% of all diseases today are not treatable with orthodox medical procedures. So what does that mean? Treatable. First of all, what does the term treatable mean? It means there's a start and an end. It means same thing as if I've had maybe let's say I've taken an antibiotic for 7 days. Typically after the 7th day, I'm all done. I no longer have that bacterial infection. I've healed. I've moved on. And orthodox medical procedures, that's drugs and surgery. So what they're saying is drugs and surgery do not turn around 90% of all the diseases. They're not resolving, essentially. And so what are they doing? So what they're doing, 90% of all the diseases today are being managed. Okay? So they're being managed by the medication, and your labs are looking somewhat okay, but what's not happening? Your health is not being resolved. You're not healing. You're not turning around any condition. It's simply being managed. 90% of all diseases, including diabetes, is simply being managed. Your symptoms are being managed by medication. Now, I want you guys to think about something. Medication. Let's say I'm taking medication. Let's say I have high blood pressure and the doctor prescribes me medication and my labs all of a sudden show that I don't have high blood pressure while I'm on those medications. Does that mean I'm still hypertensive, like I'm still an individual that has high blood pressure if I'm taking a medication, yet my blood pressure is normalized? Absolutely not. It means that I still have high blood pressure, but it's being brought down by medication. So do you think the longer that I take that high blood pressure medication, do you think my body gets better or worse? Healthier or sicker if I'm taking a medication and my labs look okay, but ultimately I still have that underlying issue? Think about it this way. Think about it as there's a way I describe it in my workshops. Let's say I'm really angry and someone's done something to maybe upset or harm my little guy, my little boy. I have a 6-year-old. And I'm just an angry mom. And I go and I'm about to scream at somebody because they're maybe offending or endangering my son. Like, I'm really angry. And all of a sudden I'm about to scream. I start screaming and someone puts their hand over my mouth. That would prevent me from screaming. Does that make me any less angry? No, not at all. And if anything, does it make me a little bit angrier? Totally, absolutely. It makes me angrier if someone is suppressing my ability to express myself. So in general, that's what medication will do to the body, is that it's a disempowering process of not allowing your body to heal on its own. And it's making your labs look kind of okay. But the underlying issue is that your body's still angry and it's getting angrier because it's getting suppressed. Its own ability to heal and manage that on its own is getting suppressed. So my point here is that the longer that we're on these medications and we're not allowing our body to heal or turn around or express itself, we may look kind of healthy on our labs, but year after year, the longer we stay on these meds and we don't turn things around, we're getting sicker. So let's go ahead and talk I actually like this screen. One of the biggest issues in America's health habits, in my mind, and what I see every day, is that we're all not very proactive. There's a guy last minute taking the dog out for a walk. Oh no, it's sunset or it's dinner time and I gotta get the dog out. So we're not proactive. It's kind of a human trait. Something things get to the point where we get a diagnosis and then we try and turn it around, or we get some symptoms that are kind of scary and then all of a sudden we get serious about turning it around. So and we're taught this by Western conventional medicine typically. It's also a human nature, truly. And so what we're going to be doing today is I'm going to walk you through some really significant facts that's just important to understand. But what we're going to walk you through today are very specific steps to be proactive in your health and to control things. So the facts that are important to know, over a third of our country has a diabetic condition. 1 in 3 is either a pre-diabetic or a diabetic. The number one cause of blindness and kidney failure in America is diabetes. A diabetic is 4 times more likely to have a heart attack and or stroke. And I want you guys to know, most of you probably at this point haven't met me personally, but you should know that I'm not an optimist. I'm not a pessimist. I'm very much a realist when I give information out. And my intention is not to scare you with this data, but just to get real and to share with you just this information that is just a known reality, so that you have this information and you're educated and you're empowered to make changes in your life. So 70% of diabetics develop neuropathy. It's a very painful condition where nerves begin to erode and fail and decline. It's just very painful, typically in the lower extremities. And diabetes in general has tripled since 1980, and it's tripling again by 2030. So it's on the aggressive rise. And so you have to ask, how well is all this medication doing? How well is the insulin? How well is this insulin pump doing for us? How well are, one drug after new drug coming onto the market? How well is that doing? If it were really handling the situation, you'd be seeing a reduction in diabetes, but you're not. It's massively growing as, in my opinion, as an epidemic in our communities. And then 90% of diabetes develop diabetic complications. And those are individuals that are on medication that have relatively okay A1Cs. It might be 7.0, 6.5, 7.0. Those individuals are developing diabetic complications as well. Okay. So let's look at this. This is actually probably one of my favorite slides to get across to you guys to really understand the big picture here. So you look at the top here, it says your drugs are only affecting the tip of the iceberg, right? And so the tip of the iceberg from a health standpoint are your blood sugar problems, right? So you see everything from glipizide, glyburide, insulin, actose, metformin. It doesn't matter if you're taking fast acting, slow acting, if you're on insulin, if you're not. If you're just beginning to take metformin, regardless, those medications, their goal and their primary and practically exclusive goal is to keep your blood sugar in a safe place. But what you have to look at is what is at the base of that iceberg, what is really driving your blood sugar problems. And what we find, again, I mentioned this in the beginning, is that you've got a room full of diabetics, and those diabetics, they look different. They've got different racial backgrounds, different lifestyle backgrounds. They're different gender, they're different age. Everyone's got a different story. and they're all being treated the same. They've all basically have the same type of cocktail, the same type of medication, and it's upsetting. I get upset and really frustrated with this reality. And so what's happening is that we know functionally that every diabetic becomes a diabetic for a unique reason. We find out through functional testing. And then, well, what does that tell you? If every diabetic becomes a diabetic for a unique reason, what do you have to do? You have to treat every diabetic uniquely. Every single person needs a unique approach to turning things around for them, because everyone loses their health in a unique way. So on the bottom here, you look at the adrenal glands, you have to look at the thyroid, the gut, the liver, the immune system. Through day-to-day life and living, we lose our health depending upon stressors, environmental impact, chemicals. There can be a small portion of genetic inheritance there, not a very great deal. There could be standard American diet, sedentary. So it's a combination of how we lose our health down in those 5 key systems that impacts infections, inflammation, and can trigger autoimmune diseases in the body. So that lower 2/3 of that iceberg, you got to get a real good handle on, and you got to get a real good handle on for every single diabetic. Then you can understand, hey, what do I do? How do I turn this around and actually heal? So first of all, I want you guys to understand how easy so I'm a holistic doctor, right? I practice functional medicine, and my original doctorate was received in about 2006, and that was in chiropractic. And then all of my postgraduate degree focus has been in functional endocrinology, functional blood chem analysis, functional nutrition, functional physiology, functional movement. So I consider myself, and all of my patients consider me, and the community considers me, a holistic doctor. I want you to understand how straightforward, not downplaying my role, but really how straightforward it is to think as a holistic doctor. And so when you guys think of a plant that's wilting, what's the first thing that you would think of? Okay, I got to get my plant in, back in shape. What do I do? How do I take care of it? I water it. Most of you guys were probably thinking that. What's the second thing I do? It needs sunlight. And the third, nutrients. And the fourth, hey, I might need to repot it. Okay, guess what? It is not much more complicated from a holistic standpoint. Of course, we have to layer in testing and holistic measures to turn things around, but you need the nutrients, you need to remove the toxins, and you need to give the day-to-day basics that we all, typically take for granted. So whenever I'm teaching in our classrooms here at the practice or doing public education, I really remind our community on how simple this really is to take care of yourself. But instead, what about our healthcare system? So we're feeling a little bit like a wilty plant, not feeling so well. What's our first thought? What do I have? Oh my gosh, what do I have? My stomach's cramping, I can't sleep, I've got pins and needles somewhere. What do I have? So we go on WebMD and we find out. We go to our doctor. We just have this obsession with getting a diagnosis. The second thought is, okay, what do I have now? What do I need to fix that, right? How do we think like that? Why do we think like that? The pharmaceutical companies are spending billions of dollars a year to make us think that way. They spend far more money on advertising than R&D. And so let me ask you something. When you guys those of you that are diabetics, I imagine that you're on a medication. How long do you think that medication how long do you think that medication that have been prescribed, for how long? What's the lifespan of that dedication? Is it a couple weeks, couple months? Yeah, those meds are prescription drugs for life. Okay, because there's no plan in place to turn it around. So, and I really need to focus, and I'm going to kind of switch gears here for a minute to talk about diabetes and what that's about and why it's happening. But I've had to focus the first part of this talk really clearly on the lane that you guys are in from a healthcare standpoint, because you really need to understand how destructive it is in terms of the lane being one drug after the next to try and regain your health. You need to understand how destructive this lane is in, and you need to be educated on basically getting out of that lane and getting into a completely different lane of taking care of yourselves. So I really see my role as a doctor, the Latin term for educator is doctor, and I take that role very seriously. And so that's why I've spent a few minutes here on the front end of this webinar to really help you understand the lane that you're in and how dangerous it is, and that it's time to get in a new lane. So I want to talk to you a little bit about the diabetes myths that are out there. Every single patient that I meet with has this in his or her mind, and it's important to really, truly reinforce that it is just a myth. It's not true. So here's the first one that I'm always hearing is that, you guys are told that the diabetes, it's always just going to get worse. It's a matter of managing it, and we just don't want it to get too severe over time. So again, be a good diabetic, exercise, eat right, and take your meds. And if I give you more meds and I up your dosage, by all means, continue on that path. And so the truth is, according to the Center for the CDC, Centers for Disease Control, diabetes is preventable and controllable. Well, I would take that one step further, because in my office, we see that it's getting resolved. Day in and day out, diabetics are reducing and eliminating their needs on medication. Their energy is changing. They're losing weight without exercising. They're, at least in my practice, they're getting educated on how to eat, how to take care of themselves, what nutrients they're missing, how to order the right supplements, and it's being resolved. And so just know that it does not always get worse. It does get worse if you simply stay on one pill after the other approach. That's true, but you don't need to. So diabetes is genetic. You just have to learn to live with it, guys. It's in your family, and this is a myth. And I understand where this came from, because so many diabetics look around them and say, well, my cousin's got diabetes, my mom and dad had diabetes, all of my relatives have it. My goodness, I'm surrounded by it. I think it's just my turn. And the research is really clear. Lifestyle absolutely can trump genetics. The average genetic connection with diabetes is 3 to 4% of diabetics are in that place because of a genetic connection. So that means it's close to 96 to 97% of diabetics are a diabetic because of lifestyle issues. So that's good news for you guys. That means that you can do what? You can control it. The third piece is, as long as you take your meds, diabetes is not a big deal. I think we've talked about this for the first few minutes here. So I would just say, oh gosh, really? It's not a big deal? And the biggest reason it's not a big deal, in my opinion, is that 90% of diabetics experience complications. And these are the beginnings of the complications. So certainly weight gain. And you may think, wait a second, is weight gain a complication? Or isn't that why I got diabetes in the first place? So what we're finding is that it's excessive weight is a byproduct of being a diabetic, not the other way around. Okay? So when our diabetics begin to restore their health, the weight starts dropping pretty quickly, and that's not with aggressive exercise. So our diabetics lose weight quite easily without aggressive exercise. We certainly put them in a functional movement process to get them moving, but not through wildly exhaustive means on the exercising front. So a complication is weight gain. The second complication that we're seeing is neuropathy. It's a very painful, like I mentioned before, a painful sensation, typically on the bottom of the heels, because the neurology is dying, the nerve's dying. A common complication is something called PVD, peripheral vascular disease, and that's where the body has an inability to heal, and it typically happens on the extremities, and that's because of the gross quantities of glucose that's in your bloodstream and is not getting into the cellular level. So if glucose can't get into the cells, it's a requirement for healing, and it's really common with diabetics to have PVD because of the glucose issues. Heart attack and stroke, that, like we mentioned earlier, it's 2 to 4 times more likely for a diabetic to have heart disease and stroke. Eye disease, that's the issue with, that's why blindness is the number one, the diabetes is the number one cause of blindness in the U.S. Kidney failure. And a lot of folks have the thought that, oh gosh, my kidneys kidneys in general are declining because for 2 reasons. The meds, the challenges that kidneys have to process the medication that you're on, you're typically, it's increasing over the years, as well as processing the increased density of the blood when the glucose is high in the blood. It's difficult for the kidneys to process that, and we see the GFR rates and we really go down with diabetics, and we can quantify kidney disease, what stage it's in, and really pinpoint support to the kidneys as the blood sugar is getting resolved. We're also seeing, obviously a burden on the family, and most of the patients in our practice have that in the back of their mind, that they really, they don't want to be a burden on their family. They don't want to be driven to dialysis appointments. They don't want to decline to the point where they can't take care of themselves. And then ultimately, certainly loss of life. And most of our diabetics have friends and loved ones that are no longer here. And that's a big motivator. Sometimes as devastating as loss of life is, it can be a motivator to those of us that are still living on how to take care of ourselves. So let's jump in. These two slides are really helpful in getting some basic understanding on why the pancreas doesn't have a whole lot to do with turning around your diabetes. And I know that you're told, hey, it's a pancreas issue. I got news for you guys. It's 99% of our patients, it's not a pancreas issue, but it has to do with their cellular levels. So the first key to defeating diabetes is controlling the insulin surges. And so you want to look at this little slide here. Does a pretty good job of the way that the insulin and glucose kind of piggyback on one another to get into the cell. That's how glucose gets into the cell. It kind of piggybacks into insulin. And we're born to have this process happen really easily so that there's no barriers at the cell membrane level, that's this cell membrane level, to prevent the glucose from getting into the cell. And the cell is all the cells throughout your body. And so within the context of your systems. And so what happens is that when there's something called insulin resistance, and that is when your blood sugars go up and down over time for a lot of different reasons. But what happens is that you get this kind of red shell, and that's just a communicating and kind of graphically showing you that the cell gets has a resistance in its lining to the glucose and the insulin entering. And there's a lot of reasons, and we'll talk about, and actually on a few screens ago when we were looking at that iceberg, when you looked at those issues in the thyroid, in the gut, in the liver, and inflammation in general, undiagnosed infections, all of those different factors individually create insulin resistance in the body. So the ultimate goal with defeating diabetes is to remove the insulin resistance, right? To remove that red graphical line, basically. So, and just so you guys understand this, And that red line is basically a buffer. It doesn't allow the glucose and the insulin to get in. So what your medications are doing is that they're increasing the glucose, increasing the insulin for hopes of kind of jamming it into the cell. And what do you think that does? Do you think that kind of irritates and creates more resistance over time? Yeah. That's why you need medication over time. So it's similar to if you spent a day with, let's say 5 or 6 2 or 3 year olds, little kids, and they just spent the whole day, and they were in a rowdy place, and they were just screaming and having a good time, kind of at the top of their lungs. Maybe you spent the day at the park. And at the end of the day, after let's say you're the only person taking care of these kids, aren't you a little desensitized? You're not really hearing the screams as much as you did at the beginning of the day. Like you couldn't really screaming, "Oh, mommy, I want this," or "Hey, I need this," or "Push me on this swing," or "Let's go run around the grass," or they're just screaming at the top of their lungs. So you get desensitized, so you don't hear them as well. Well, what if someone gave them, that team of little kids, gave them these big mega sound blasters, those cones that they could scream louder at you? "Push me on the swing," like 10 times louder. Would that make you want to help them? It would make you probably want to run away. But that's basically what's happening when your body's been given more and more insulin or more medication to get the glucose in. You become more and more resistant. So hopefully this helps you understand why the solution of more and more medication is not the answer, but the answer instead is resensitizing those insulin receptors so that you're removing that red line and the glucose naturally goes in without the help of medication. So removing that red line is what we do in this practice, and we help the body resensitize those insulin receptors, but we have to understand in the first place, why did that insulin resistance form in the first place? And we do that through ordering all the right tests and setting up a bio-individualized process that helps you guys get through that. So one other aspect from a functional medicine clinic that's really important to understand is lab ranges. And what we do in general, when individuals go and get their labs taken, let's say you guys in general, a diabetic goes in and gets their lab taken, probably the first thing you do is you look at all those H's and L's, right, next to all of the lab marks, like, oh, where am I high, where am I low? But have you ever thought, well, what is that high and low compared to? So let me ask you this. Who do you think in general gets their labs taken quite frequently? Do you think people that are well, or do you think people that are not so well get their labs taken frequently? So right, it's those and this is with utmost respect to everyone that's listening to this webinar, those individuals that get their labs taken in general are that those folks are not so well. They're typically dealing with something. And so your H's and L's are being compared to all those individuals in your geographic region that basically are not so well. That's why you can be a diabetic in Arizona and not one in California. So I don't know about you guys, but I want my labs and my family and my community's labs to be compared to on a higher standard. And that's what we're doing in functional medicine. Let me help you understand that. So the lab ranges are inaccurate because they're being compared to a group of people that are unwell. Bell curves are used, so the lower and the high ranges are kind of lopped off. And in a functional lab approach, they're more sensitive to reveal problems. So let's look at this. This is, and hang in here with me for a minute. This looks can look a little technical, but it's really important that you understand this, because this is how we manage labs in this practice and how you really want your labs to be managed. And so A1C, and incidentally, we do this for every marker in the body, whether it be how well your kidney's doing, the health of your liver, your inflammatory levels, what's happening with your A1C, your glucose, protein serum levels, everything that we're analyzing, we do this on a functional standpoint. But let's look at just one marker, and that would be an A1C number. So what happens when you guys get basically around, so what happens when you get to 6.5? So that's actually when you're diagnosed as a diabetic, okay? But what happens, let's say maybe 6 to 12 months before you became a diabetic, let's say your A1C was anywhere between 5.5 and 6.4. What was your doctor telling you? Well, chances are they're saying, well, Mary, let's watch this. Your A1Cs are getting high. Let's watch this. Well, my response to that is, well, let's watch what? Let's watch me get a disease? So unfortunately, again, those doctors do what they're trained, and they don't have any mechanism to turn a degenerative process around, and so they wait until it's a diagnosis day for you. So the flip side of that, in a functional wellness clinic where we're restoring health functionally, we, on all markers, anytime anybody in our practice, because we work with a lot of diabetics, probably half of the patients in our practice are diabetics, maybe the other half or close to half are individuals with thyroid or hormone issues. But then there's a lot of folks that have high blood pressure, sleeping issues, some weight. So we look at a lot of markers, but with an individual that had an A1C anywhere near 5.5 or higher, kind of getting in that slippery slope to becoming a pre-diabetic, we functionally do not wait until you're diagnosed with diabetes, but we put all of our programming in to turn that around so that we keep our patients and we restore health to the point where you're in between 5.0 and 5.5 with your A1Cs. So when we help our diabetics restore their health, we like to get them into the low to the mid 5.5s in their A1C. And if we're looking at measurements where, hey, there's some issues with your kidney. Your kidneys might be stage 1 kidney disease. Maybe the GFR rate is going down and it's declining. We do not wait until, obviously, you're getting close to needing dialysis. We turn that kidney health around way before it gets dangerous. So you have to ask yourself, is this what you want? Do you want to be this proactive in your health? Most people say yes and are nodding their heads when they look at this and are feeling really confused as to why their doctor isn't managing them this way in the first place. And 2 reasons. One, insurance doesn't really pay for restoring health. It just pays for medications. And then the second piece is that your doctor isn't trained. Your doctor typically isn't trained for being very proactive in your health. They're trained to prescribe drugs and surgery. And in certain circumstances, again, in acute care, that's really appropriate. And we want that, but not in restoring health. So let's talk about getting help and what you do and how this works. So the first piece of getting health, and I love to ask this question when I'm in these live seminars because it helps me understand how well I have educated those people in front of me. So I want you guys that are watching this webinar to ask yourselves right now, how well do you think you can predict the future of your health, separate from a communicable disease or a terrible accident? Because those are tough to predict. So the answer here is a very strong, resounding yes, capital Y-E-S. A lot of people are like, what do you mean by that? How on earth can I predict it? So here's how you do it. The first step is you have to order the correct tests. In our practice, we order comprehensive blood, we order stool tests to understand the gut and the liver, and we look at hormones to understand what's happening hormonally in the immune system. How's that being managed? You got to ask yourself, wow, do I really think the correct tests are being ordered for myself? And I have yet to meet a diabetic or a pre-diabetic in my practice unless they came from another functional medicine clinic who's had testing that does anything more than tell a doctor what medication they might need more of. So you need to order the correct tests to understand individually what's happening. The correct tests then give us the ability to understand the true, unique underlying cause. And the underlying cause, I can just tell you from experience, guys, it's not being looked at. You are not your A1C number. You are so much more than that. And we have to look at what is the unique reason that you became a diabetic in the first place. You have to focus on the cause and not the symptoms. It doesn't mean that we're not, compassionate and empathetic and want to understand your symptoms, but we need to restore your health. And to do that, we have to understand, how did you uniquely lose your health? So we have to focus on the cause. We correct the dysfunction. We don't alter the labs with drugs. Again, you need to stay on your medication while your body restores function. And then over time, you'll need less and less and less, and typically you'll eliminate it. And you have to address the body as a whole. I just mentioned this. You are not your A1C number. And a systematic approach. You need guidelines. You need a process that's really straightforward, and what do you do when. And the final piece that you need to predict your health is you need someone in your life that sees in you the potential that you just don't see for yourself. And that's where we come in. We understand we are really good at working with diabetics, particularly the right diabetics, those that are willing to take responsibility and to follow our lead. But those folks that are teachable, really. And if you're teachable, then you're able to be shown where to go. And if you have that mentoring, you have that systematic approach, as well as those other points above, that is when you guys got this. That's when you can kind of take the bulls by the horns and turn it around. And so the missing pieces, these are what we refer to as the 5 pillars of health in our practice. They all start out by treating the whole person by putting the pieces together. We start out with a thorough detox that is supported by us. It's followed up by nutrition. We absolutely have to find out the right foods that are feeding your diabetes and the other foods that are feeding your healing process. And they're going to be different for different diabetics. I could have 2 diabetics in a room, and the food that could absolutely soothe Mary could absolutely set off Joe and his diabetes. So there isn't a diabetic cookbook out there, guys, but you can craft one and understand through paying attention and getting support on what are the right foods to eat for you as a diabetic. We have to put our attention on inflammation, and you can quantify it. You can put a number on how high that is, we put in place protocols right out of the gate to bring that down. And inflammation, guys, just in general, that's the precursor to everything awful. We know that as a health community, that inflammation is the precursor to heart disease, to cancer, and to stroke. And you can be very proactive with inflammation, but you have to test for it. The 4th piece is we have to check out your hormones, particularly your adrenals. And then there's about 599 other hormones in the body outside of adrenals. And the key there is to balance them. We do that we do a saliva test that our patients take at home. But we have to balance those hormones. The difference between us and, say, going to heading out and getting hormone replacement therapy or an endocrinologist visit, we do not believe that in general that people need hormones replaced in their body. That's kind of a last resort. We need to find out what's wrong with your body in the first place, that it's not producing the correct hormone balance, and work to restore that. A lot of that actually happens in the gut, where the hormones are nurtured. So we look at we do a lot of gut studies through a stool test. And the 5th piece is the immune system. You need a really strong immune system to manage your blood sugar control. So we assess immune system. So these 5 factors, typically, when I speak to patients live or people in a workshop, I usually ask people, well, who here has done one of these? Who's done 2 of these? Most people haven't done 5 with a system and with an easy to follow system in place. Because without a system, even if you have all 5 of these kind of with a guidebook in front of you, you're going to fail. So the next piece, you have to ask yourself these questions to make sure that's a good fit for you to be considered for a functional medicine clinic. The first one is, how would life be if I were able to resolve these health issues? Truly, how would life be? Would I have more energy, more energy? Would I feel more confident about my future? Would I be able to spend more time with my family? Would I be able to travel? Would I be less stressed out about my health? What would life be like? How has it been affected to date? Your relationships, your ability to work, your ability to enjoy your family, your life. Has it been affected? And really the answer is, on a scale of 1 to 10, how motivated am I really to jump into the driver's seat? So guys, we personally meet with folks that are 8 and above out of 10. You gotta want this for yourself more than I would want it for you. And I get pretty passionate about life and living and health. And it's always a little dangerous when I want this more than our patients do. So if you're an 8 or above, then I absolutely welcome you the opportunity to meet with me personally and see if, in a very down-to-earth way, in a very black and white way, if you can be helped. So let's go ahead and look at what that looks like to come on in and have a consultation, a comprehensive diabetic evaluation, and to see whether or not you are a candidate for resolving your diabetes and whether or not we can work together. So the consultation, it's really a complete wellness evaluation. It's an hour. I require spouses to attend. I really need to make sure they're going to be on board and supporting you with the work that we're going to do together. And ideally, if you have labs with recent labs within the last 6 months, it'd be great if you could bring that in. If you do not have those labs, it's okay. I can still run the consult. But in general, we're going to go through a real thorough health history. Know your health history. Know your medication levels. It would be helpful to understand how things have transpired, the original date of your diagnosis or diagnoses. And also, we're going to talk about your instinct on what happened when in your health and possibly why, what your thoughts are there. So we'll put together this evaluation. Like I said, it's an hour. Your spouse, if you have one, is there. And it's a consultation, and my intention is, it's really simple, and it's to really get to the core understanding from a clinical standpoint on whether or not we can help you. And it's not just, can we just help you a little bit? Can we bring your numbers down a little bit? But can we turn this around completely? And so I really need a thorough assessment of your health to do that. And so there's a health consultation and then an evaluation of really your wellness potential. And that has to do with sharing in real specific detail the work that I would require you to do, and just to ensure that there would be no surprises. We talk about the details of our program and how long it would last based on what your health goals are and what your health history is. So it's just a very, very clean, very just succinct, thorough conversation on, can you be helped clinically, and also are you going to be able to be an incredible success? And when I do this, we also put together a plan of action. So we really roll up our sleeves and talk about what it is we're going to be doing, again, to make sure that there would be no stops. The last thing I want to happen, if I bring a diabetic into our practice, 2 to 4 weeks, 6 weeks down the road, I hear, oh, Dr. Scharf, I wish you would have told me that we were going to be doing this. And so I don't hear that from my patients because we're so thorough about talking about what the work's going to be. So when I do that wellness evaluation, it's typically $287. But when I have these webinars and when I have a diabetic that is educated and is motivated to put their health first, I reduce that fee by a few $100s, and it becomes an $87 consulting fee. The only way that fee gets dropped like that is if you are able to watch me in a live seminar or if you're able to watch a webinar. So I invite you to reach out if you're at an 8 out of 10 or higher and are just ready to get the diabetes off your back and to be considered for a candidate to resolve your diabetes. So our phone number is 415-721-2990. Absolutely mention that you just watched this webinar and that you'd like to have that reduced fee of $87, and we will get started with you. Okay, thank you so much. I certainly hope that this has been valuable, and that you guys, and for those of you that are ready, I'm really looking forward to meeting you. All right, take care.